my name's Sam Finnekin. I'm a GP in Sutton Coldfield, and in this video I'm going to tell you about personalised care and how it can help you get the most out of your healthcare. Personalised care might not be a term that you're familiar with, but it's fundamental to how we practice in the NHS. Personalised care means making sure that you get the most out of your healthcare, and it's about giving you control and options and choice. Personalised care approaches ensure that the information that you're given is personalised to you and shared in a way that you understand, and that your preferences and values are incorporated into decisions so that the right decisions are made for you. Another way of thinking about it is what it's not. Personalised care is a move away from the doctor knows best way of thinking or one-size-fits-all healthcare. One of the most obvious opportunities to make sure that your care is personalised to you is when it comes to making decisions about your care. Whenever you come to make a decision with your health professional, whether that be a doctor, a nurse, pharmacist, or someone else in the team, it's important that time's taken to make sure that that decision-making process is personalised to you and that you make the right decision. Decisions about your care come up with almost every time you talk to a clinician. It could be about what treatments you want, or whether to have a test, or where to have your care. The important thing to remember is that the decision is yours to make, and your clinician is there to support you to make the right decision for you. When making decisions about your care, there are three important things to remember. Firstly, there are always options. It may be that one of the options is doing nothing and the other one is just doing something, but there's always going to be options to discuss. Secondly, each of the options have different risks and benefits. And finally, your values and preferences are individual to you, so it's important that they're discussed. Whenever you're faced with a decision, it's important that all the options are made available to you. Your clinician might recommend a best option, which will be based on their experience and their knowledge. But it's important that you consider all the other options to make sure the decision is the best one for you. Which option is the best option isn't always clear. This is surprising to some people, but it can be because sometimes the risks and benefits of the different options are quite closely matched. But also the important thing to remember is that only you can decide how each of the treatment options will affect you and your life. And so we need to incorporate how you feel about the options in the decision-making process. It's really important, therefore, that after you heard about the options, that you discuss how you feel about them and how they'll fit into your life. Only you can decide how the options will affect you, and so discussing how you feel about them and your preferences will allow you and your clinician to make sure that you make the right decision for you. Remember that most decisions don't have to be made there and then on the spot. Sometimes it's best to have a think about the information, perhaps talk it over with a trusted friend. Your clinician might be able to direct you to some resources that help support your decision making. That might be a website, a leaflet, or a video. Take the time to consider all the information to make sure that the decision you're making is right for you. Also, most decisions can be revisited at another time. So if you make a decision and then want to have another think about it, then that's perfectly fine. It's okay to go back and have another chat about it. Personalised care means making the right decision for you. It's your clinician's responsibility to make sure that you're aware of the options and the risks and benefits of the different options. And you can help them to make sure the decision is right by making sure that you tell them what's important to you and how you feel about the options. Sometimes it can be useful to remember the acronym BRAN, B-R-A-N. The B stands for benefits. What are the benefits of the different options? The R stands for the risks. What are the risks of the different options? The A reminds us to ask about what are the alternatives to the options. And the N means nothing, because there's always the option of doing nothing. By talking through the options and what's important to you, you can make sure that you make the right decision for you and that your healthcare has been personalised.